How to Burp a Baby by Cindy Rubin. I'm a breastfeeding medicine specialist and fourth trimester doc in the Chicagoland area. So there's not really any real way to burp a baby. We burp babies because sometimes they take in a little bit of air when they're eating or crying or doing other things, and it just helps them to feel better when they can burp it out. Usually, oftentimes, we're feeding babies in some sort of kind of horizontal laying down type of position. And when that happens, the air can get trapped. So simply putting them in an upright position like this, whether they're on your shoulder or sitting on your lap, that in and of itself lets those bubbles rise up and the baby will burp. Some people do just naturally kind of do a little bit of padding. That may help bring the bubble up a little bit faster. There are some techniques of kind of moving the baby a little bit, not shaking the baby, but rocking a baby, patting the baby, changing positions multiple times if you're not able to get one out. But really, truly, you don't have to worry too much about burps and making sure that burps happen, because if there's not much air, there may not be a need for a burp. And anything that's not burped out, it's going to come out in the other direction. So it's not something like if your baby hasn't burped in 20 to 30 seconds, especially if you're in between feedings or your baby's tired and you want to put them down, you don't have to keep trying for a burp. But a burp in between each breast and partway through a bottle, maybe multiple times, can sometimes help a baby just make a little bit more room for the feeding to be more full so that then they will sleep, get a good sleep cycle. You can get some rest in between feedings.